Thanks so much for reaching out to invite us. My name's Kat McGregor. I'm a GP trainee. I work in Lawrence Hill in Bristol. And I just want to give you a bit of background how I became interested in this, because it's a relatively new journey for me as well. I was aware of there being issues with high levels of air pollution, poor quality air, dirty air around the area around Lawrence Hill. What I hadn't realised until I started looking into it was how severe that was. So Lawrence Hill actually has some of the highest levels of air pollution in the country, and within Bristol has some of the lowest rates of car ownership. And I think that just really struck home with me. And as I started seeing patients more and more, realizing this could, really be having an impact. So that's how I became interested in this. And then I went along to I became involved in a pilot study that's with the UK Alliance on Climate Change, along with Global Action Plan, to kind of discuss with health professionals and educate health professionals on how we can talk to patients about air pollution, about this great threat to our health. So that was part of the pilot, and that's how I became more involved and active. This presentation, actually, some of these slides are courtesy of Harriet, who's a doctor who works in paediatrics and is part of Medac, so thanks to her. She wasn't able to be here this evening, and again, some of the references and information is from those resources that I got from the pilot study from Global Action Plans. That's Professor Stephen Holgate and Professor Jonathan Grigg both did teaching sessions for that. So, and I've referenced throughout. I'm happy to be interrupted, so if there is anything that's unclear, please do either Dorian interrupt me from things from the chat, or feel free to unmute yourselves. So I'm just going to give an overview of kind of what impact air pollution does have on our health, what it is, what we're talking about, overall what's the burden of air pollution related disease beyond just being significant, and talk a bit about who is most at risk, and then what must we do to protect ourselves, our families and communities. I'll kind of touch on this, but also hand over to Chloe, because it was becoming clear to me that within the health sphere alone we weren't going to be able to deal with this huge problem, and that's again what got me to be involved in the campaign. When we're talking about air pollution or dirty air, kind of in a large sense, air pollution can be all kinds of things. So we're talking about anything that's in the air that can damage our health. So that could be gases, reactive gases, particles. These can come not just from traffic fumes, but from industry, burning of fossil fuels, wood burning stoves, from agriculture, from all kinds of places. So it's a very, very, can be a very nebulous term, and I think that can lead to some confusion. To clarify, what we're mainly focused on, what I'm mainly focused on this talk, is traffic derived air pollution. I don't think it's the only type of air pollution we need to be worried about, but in the UK and in cities, that's probably one of the things that we're most concerned about. And we talk about a few things. We talk about particulate matter, PM, and we talk about nitrogen dioxide, which is a highly reactive gas. And again, these aren't the only substances and the only gases that can cause damage, and they're not particularly always that easy to measure. But that's some of the things that are released from emissions. Also, though, related to traffic related air pollution are things that are related to brakes and tires burning, tires being, friction from them on the roads, and also the reactions, very complex reactions that occur from organic chemicals that have been partially burned and are up in the atmosphere and combined with things there. So this is a complex area, but the evidence is unavoidable of the damage that this causes, and I'm just going to go through in some, in a little bit of detail of how that happens and how it happens. And essentially it happens throughout our life course, so that from in utero as a fetus, if your mother lives in an area that has high levels of these substances, that can cross the placenta. It can damage the placenta itself, resulting in low birth weight or preterm birth. And there is increasing evidence that it affects particularly lung development, but probably cognitive development as well. Probably looking at lung disease is where we have kind of our most familiarity with the health impacts, both direct toxicity to the lungs, exacerbating existing disease, but actually causing new disease. So in children, we can identify that, again, in those areas with high air pollution, they are more likely to develop asthma, new onset asthma, in addition to having worsening of existing disease, but not just causing disease, so also in lung function. And this is something which I as a medic, I wasn't aware of this, that because of the effect probably in utero, but also in childhood, because of the way that inhaling these chemicals and the impact that they have impairs development of the lungs. The children in these areas are at high risk of having poor lung function. That in itself is not a disease, but what that means is that you're more at risk of communicable diseases, infections, particularly relevant at the moment with COVID-19, where we have seen in areas of high air pollution how much more at risk those people are. And when that's, and particularly in children, which I think is just absolutely alarming. There are also effects on the heart, effects on the brain. It really is wide reaching, and that particularly for me was something that I was not aware of when I started looking into this. Cost to the health service, so they're looking at £22 billion per year in the UK, and a reduced life expectancy as a result. And I think you've seen that in the news possibly today, how it's estimated that air pollution can reduce life expectancy by 6 months. And the other thing to say is that a lot of these could well be underestimates, because we're learning about these complex interactions. It could well be that that's even more significant. I think scary. Quite a busy slide here, and probably I didn't want to go into too much detail, but just kind of going over really that what can happen if you inhale these particles. So looking down at this image of the lungs here, as I say, in addition, what happens often if you inhale something that's a potential damage is that little cells in the lining of the lungs absorb them. They're called macrophages. They absorb the chemical. They want to protect you from it, and you make sputum and you cough it out. That would be the normal mechanism, or it would collect in your nose, and eventually you'd get rid of it. And our bodies were made to protect us from these types of threats. But what's happening when we're talking about air pollution is very fine particles that can be inhaled and then pass through the membrane. So they pass into the bloodstream, into the cells lining the lungs. They can pass into the nerves of the brain, and it's these effects that we're starting to understand better. So oxidative stress basically means our ability of our body to react to the stress or to the damage that's being done by these particles or these chemicals and these gases. And over time, what happens within blood vessels, within organs, when you're reacting to it and when you're trying to fight off that threat, is you have this inflammatory response. The body's angry. It's trying to protect you, but what it can do on its way to doing that is develop what's similar to what we see in stroke and heart attacks, is plaques, thickening of the blood vessels. And this is systemic. This is throughout the body. It's starting to emerge that this is what's happening. So yes, we're desperately worried about people's respiratory and lung diseases, but we're recognizing that this can cause strokes, heart attacks, contribute to diabetes, contribute to cognitive decline, dementia, and as I said, about development of children's bodies, really. So really the far-reaching effects are really quite terrifying. In terms of globally, and I don't want to go on too long because but just to put it in context again, there's been recent studies suggesting that air pollution is responsible for 1 in 5 of all deaths. Again, could well be an underestimate, and in some areas that's going to be even higher. This is a graphic from some data from UNICEF looking at the effect on children. So you can see that where that particulate matter level is particularly high, particularly in areas of sub-Saharan Africa, Asia, Indian subcontinent, And in areas like this, 300 million children are living in places where these outdoor air pollution exceed international limits. I think it's worth saying at this point, though, that whilst there are thresholds put out there and aims for, for how to keep both particulate matter and gases below a certain level, there is evidence from studies that any exposure to these chemicals and these particles are contributing to ill health. So whilst there might be what's deemed a safe level, that really doesn't exist, and there should be targets in place. We should be able to measure and look at risk, but risk exists wherever there is exposure to these, and that's becoming increasingly obvious as well. Looking more closer to home, and this number has just gone up and up as evidence has come out, but approximately 40,000 deaths per year attributed to air pollution in the UK, and I've mentioned that figure of the impact on cost to health services, which at the moment becomes ever more relevant, and particularly as those two forces combine, of you've got a respiratory illness, an infectious pathogen, and you've got people who are through no fault of their own at an increased risk of not just catching it but not being able to fight it off, and unfortunately from death as a result of it. It's never been more important to look at this. So this is a case that I'm sure many of you will be familiar with, but Ella was 9 years old when she died of a fatal asthma attack in 2013, and she lived incredibly close to the South Circular in London, just a few hundred, not even 100 meters. I think she lived like 80 meters from that road. She was admitted 27 times in the last 3 years of her life. She also suffered from anoxic seizures, so she would have very low oxygen in the blood, and unfortunately that would lead to seizures, and she had many intensive care admissions. And her mother never gave up fighting for it to be noted, the effect that air pollution could have had on her death. And finally, at the end of last year, a coroner said that whilst asthma was the underlying cause of death, it was exposure to excessive air pollution that caused this. And that's been the first time it's been documented as the cause of death. And I think just a really tragic personal story to indicate that Ella unfortunately is not alone. And there will be many other cases that are similar to this, but what we need to do is rather than this, it's obviously a tragedy, but it's to act on this and prevent other children from going and other adults from experiencing the same, and that's the legacy her mother wants to continue.
Catherine, is that, sorry to interrupt you, is that the first time that's been put as a cause of death in the UK or worldwide?
That's a good question. I am only aware of that being the first time in the UK from what I'd read, but I'm not sure.
Thank you.
I think it's been quite. I think it is. I think it could well be the first time, but I'm not 100% sure.
Thank you very much.
Okay. So looking at Bristol. So this is just a map of. This is actually nitrogen dioxide. Areas where nitrogen dioxide is above the recommended threshold. As I've mentioned, it doesn't necessarily mean it's safe outside of this zone, but this is where we're kind of looking at the most severely affected areas, and then in Bristol it's thought to be about 300 deaths per year, so 8.5% of all deaths in the city are related to air pollution, and road traffic being the main source of these emissions in this area. And this is not equal. So in some areas, as I've mentioned, Lawrence Hill being one of the most affected wards, that's up to 10% of all deaths, and in others it would be lower. So and again, just trying to put it into context. So every time this varies through time in terms of how high air pollution is. So on a high pollution day, an extra 12 children will experience symptoms of their asthma, and 5 will have an asthma attack necessitating an admission. And also what data is showing us, particularly a large study in the States, is that actually reducing air pollution, reducing exposure to these gases and particles will prevent disease, so will improve outcomes for people. So reducing air pollution by a fifth would prevent 6 out of every 100 cases. So that would equate to 18 fewer cases in a place the size of Bristol. And also, these effects are not just over the long term. So it's not just a case of you're living in a high level, a high pollution area for years, and therefore this risk builds up. This can be short term. These are people walking to school who are then being exposed, and that short term exposure is significant, and not just in respiratory conditions, but also in the short term as well. So the risk of having a stroke in Bristol is higher on a high pollution day. And as I've alluded to, air pollution affects us all, but it affects certain groups in a much more significant way. And as always, it affects our most vulnerable. So that might be because of health conditions, it might be because of pregnancy. We talked about the effect in the uterus on the fetus, those with existing or communities with poor air quality. And I think that, that's why this cannot just be on an individual level. Action on this, needs to support and even focus actually on those areas and on those vulnerabilities to re-level the playing ground. So air pollution affects us all, and I think I just wanted to finish on kind of, I love living in Bristol. I cycle to work. I want to remain living in a place that is safe for me, for my family, for my patients, and we all know someone who has a health condition, has children, and I think just the more I've been reading about this, whilst I am scared and in some ways feel quite overwhelmed by this, it's made me more want to be involved, and that's what led me to be to reach out to people like Chloe and Mike in the MedAct in the Our Air Our City campaign. So I'm going to leave it there. I'm happy to take further questions at the end, but I'll hand over to Chloe now, just to take you through the campaign.
Yeah, just before, Chloe, if you want to start bringing up the slides, that's absolutely fine. But I just wanted to step in. Libby asked a really interesting question about whether Ella was the first person to have officially died because of air pollution in the UK or the world. I looked it up quickly while Kat was talking. It is the first in the world. So if anyone else was curious about that and wasn't able to read the chat box, yeah, there you go. So yes, our next speaker is Chloe from the Our Air Our City campaign, and she's bringing up her slides now. And yeah, Chloe, you are still on mute, by the way. So any second. There we go. That's better.
I'm on my laptop. Apologies, I'm slightly less dexterous with the controls than I am used to being in these situations. No, but thank you everybody for having us here this evening, and thank you all for being here and for being as engaged as you are in the issues of the environment that affect us all living in this city. I am a theatre producer by trade. I'm also a born Bristolian. I'm a cyclist and I'm a mum. My two boys are 11 and 8, and they are, in no small part the reason why I've given up a lot of my time, particularly over the last year, to sort of being involved in campaigns and in ways of taking action. I've become very involved in Extinction Rebellion. I'm also involved in Culture Declares Emergency, which is the arts' response to the climate emergency. And really, what fuels all of that is the sort of information that Kat's been talking about, because I think it's this sort of information around us is inescapable, isn't it? So I saw this graph in the summer. This is a graph of information that has been pulled by Extinction Rebellion, and as you can see, this is tracking the impact of the lockdown at the beginning of last year. And the striking thing for me was that there was only 1 week in 2019 where we in this city and my children, of course, were breathing clean air, and that for me is something that I can't not get involved in.
I'm not sure we're seeing the same screen as you. I think we're just seeing the beginning of your slides.
Right.
I don't know whether that's the case for everyone.
Yeah, so at the moment you've got the Our City website up.
So
I think if you want to show your slides better, you just need to press the present
I will.
button.
It's just, sorry, I'll show the graph at the end. I'll show the graph at the end when I've worked out where it is, if it's not in what I'm sharing. So where we are at the moment is we're at a really critical point for discussions about air pollution. I'm just going to show you these. These are articles from papers that have just literally popped up in the last few days across different news sources, but absolutely everywhere people are suddenly discussing and acknowledging the impact between health and air pollution and the extreme situation, the extreme crisis that we're in. It's fascinating, of course, looking at the graph that Kat was showing about air pollution globally. And actually, when you look at what's happening in the UK in comparison to what's happening across, across Africa and across the rest of Europe and Asia, it's it's nothing. It's nowhere near as bad here as it is there. But it's still, as Kat was saying, any exposure is dangerous. And for me personally, I can only really get involved in things that are immediate and here. We can't all solve the problems of the whole world, but all we can do is do what we can as individuals. So for me, it's been very important to engage with this through the campaign that has been called by XR, but has become a movement of movements campaign that is being run in collaboration with groups, community groups across the city. So our City is a group bringing together diverse groups. We're acknowledging within that we all have different ways of working. All of us as community action groups have very, very different practices. But the movement of movements principles are about acknowledging the fact that we're in an emergency. And so sometimes you just need to kind of gather up your tools and all find a way of working together. And it's a really, really brilliant practice, actually, for groups like Extinction Rebellion that are looking to seed its influence much further into society, but also to listen to the concerns that other groups have as well. I mean, that's been a really important part of this campaign from my XR perspective, is just to hear what the issues are from people who speak from different perspectives. So we have formed a steering group. It involves members of XR, it involves people from the African Voices Forum, from the Black and Green Ambassadors, from the Youth Strike for Climate, from XR Youth, and from MedAct, from Stop the Maangamizi, and from Cotton Garden School. So, there is of course always, you can always be broader, you can always represent more people, but that's who we gathered together in order to be able to make a start. And there are 4 objectives within this campaign. We've got 4 key aims. One is that we want healthy air now. We want Bristol City Council and the West of England Combined Authority to bring us within the World Health Organization recommended outdoor air quality guidelines by May 22. And it's very important that we as a group are not policymakers, we're not transport experts, we're not scientists, we're not politicians. We represent the community. So we're not here to advise policy. We're not here to say this is what we should be doing. We're here to create political will. What we really want is that there is a just implementation of changes to the way that we live in this city in order to bring our air into World Health Organization limits. So there's a particular concern for social justice within that. We want to acknowledge that it's a very complex issue, and that there are different solutions for different communities, and that we need to take into account what all of those differing needs are for people around the city. And we want to hear the truth. We want Bristol City Council and all of its public institutions schools, media, medical bodies, to explain exactly what the problem is, as Kat's just done for us here this evening. We want this to be information that people really understand, because when they understand, they'll understand the absolute imperative of acting now. And we want to see, and it's been interesting because they've literally just confirmed that the mayoral elections are going to go ahead as planned. So in May, so we want to see all mayoral candidates, both for the City Council and WECA, putting their plans for clean air on the table. As you can probably gather from what I've said so far, there are two key targets for the campaign, and they are Bristol City Council and the WECA. They are the bodies that have got the resources, the obligations, and really need to be driving this change. It's very important for us that when we are not within this campaign putting a focus on individual behavioural change. That obviously is an important part of tackling this issue, but we really don't want the responsibility of it to be pushed onto individuals. And we sort of see the council doing this a little bit. And of course, not everybody has got the same access to being able to make the changes that we're talking about being required. Being bound by morality, I think, is a form of privilege, or being able to afford and act on your morals is a form of privilege, and not everybody in the city has that. So that's why this campaign is really, really targeted towards our local and regional government. So there are 5 key audiences that we've identified to help us push forward this message. They are workers and commuters, people who have to get to work through our dirty air, or people who, through their workplaces, are particularly exposed to it. So people who work on shops on the high street, for example, taxi drivers, people who are out on the streets as part of their job. Residential groups, we want to engage communities to come together to support this campaign in order to make the place that they live better for them and for their neighbours. We want to engage health workers and those people whose health is impacted by air pollution. So the people who are suffering from the impacts of it right now, and the people who are having to deal with a frustration, for example, that Kat's voiced several times, is that as a GP facing the public coming in, you haven't really got the tools to be able to say to people, this is what needs to change in your life, because actually some of those decisions are beyond their immediate control. We want to engage people who are concerned for children, so whether that's schools, parent groups, children themselves. I think it's really important that their voices are heard within this campaign, because, as I was saying earlier, although I couldn't show you the graph, there are children in this city who have never breathed clean air. And we want to engage people who enjoy spending their leisure time outdoors in Bristol. Bristol's a fantastic city for being out and being active, for running, cycling, climbing, being on the harbour. We want to make sure all of those people are engaged in how much more pleasant it will be to be in the city if we can control our dirty air. So there's a little bit here about what the campaign will look like. This is a sort of very simple unifying logo, but there is a whole campaign of different images that, which are deliberately very, very diverse, which will be going up all over the city over the next few weeks. And there are 3 really important messages within the campaign. One is clean air right now, which is really focusing on the fact that breathing dirty air is a violation of our human right. The fact that we've got all these deaths in the city happening unnecessarily because of the pollution, and the people who are suffering from health conditions. Clean air for a better Bristol. We want to create a really, really positive vision of what it would be like to be in this city if we can make it a better place to be outdoors. So thinking about how our communities will function if our air is cleaner, how much more pleasant it will be to cycle if you're not stuck behind horribly polluting lines of traffic, what sort of positive effects it will have on our natural environment. And we want to really focus on the ability that we've seen people show to make change during the pandemic. it's clear that we all really do understand that when we need to come together for the greater good, that we can do it. And the third one is about clean air is everyone's business. So talking partly about the fact that there are so many people who have to work within the polluted air, but also thinking about the positive benefits of the green recovery, and really, you know, what we want to see is really strong leadership from the council on that issue. So where we are at the moment is we are heading towards the point at which the City Council must publish its final proposal for tackling clean air. So, as I said earlier, you know, this is all really happening right now. Last week, the City Council held its scrutiny committee meeting to look at the proposals for the clean air zones. So all of those decisions all those options are being looked at now, and decisions are imminent on that. And then, of course, it's also just been confirmed this week, the mayoral elections for the City Council and for WECA will be going ahead in May. So where we're at with the campaign at the moment is we are about to start actions. We're about to start doing things, which is great, because, of course, we felt very stymied by being in this situation with lockdown. But we are about to start doing some actions that will be targeted towards social media and obviously done completely COVIDly safe. So this is a moment for the campaign really to start spreading out and connecting with more groups. You know, if we'd waited until we had every community group in the city, you know, engaged on this issue, we probably wouldn't have ever started actually moving forward. But there is absolutely an intention to keep engaging people, keep talking, keep bringing groups on board. And indeed, if any of you here this evening would like to engage in a fuller way with the campaign, either to become a partner or to talk about how you might sort of support the actions that we're thinking about taking, that would be absolutely brilliant. So I am hopefully going to come out of that, and I really do want to show you this graph, which I thought was in my email over here, but I think because of my inability to navigate very well through this, I don't know, can you see that? Does that show now?
At the moment it's showing a blank new tab. If you've opened it in a new window, you may need to share your screen slightly differently.
Let me just stop sharing and see if I can reshare it.
Yeah,
because it is really quite striking. Can you see that?
Yes.
Great. So that's the chart I hoped to show you at the beginning of this presentation. So all the green bars are levels of NO2 in the air during 2019, and the sort of purple bars are 2020. So you can really see the impact that lockdown had. But as I said, the really startling thing for me was that there was only really 1 week in 2019 where clean air was being breathed. Well, it's not even clean air, is it? I think one of the things we really need to think about as the City Council start rolling out their clean air zone plans is compliance enough? Is it enough just to say, okay, right, we're now compliant, the levels of air pollution in the city are now at World Health Organization levels, or whatever level it is that they decide compliance is? Is that enough? You know, is it really okay if we just bring it underneath that level, or actually should we be aiming for something better than that? And the other thing that we'll be thinking about in the campaign as we as the clean air zone presumably passes into law and is up and running hopefully later this year, is we need to think about the fact that air pollution is not just caused by traffic. So there are other causes of it, which this campaign, Our City, can really engage with. We need to be thinking about the air pollution that is coming from wood burners, that's coming from burning rubbish, that's coming from tyre particles. So it's not just the exhaust that's coming out of the vehicles that is causing the problem. So the City Council will probably think it's done enough by tackling that one issue, but really it's enormously broader than that, and it's something I think that we're going to need to agitate on for a while to come. So I will leave that there, but what I'm also going to do is there is a website for RRL and there's a website for RRL which I'll hopefully share, and there is a open letter to the council, which would be absolutely brilliant if everybody here would sign and would share. Because we really want to help make the council and WECA feel like there is a huge community support behind this issue. And interestingly, at the scrutiny committee last week, they were looking at the results that had come through from the consultation on the clean air zones that had been done last year, and overwhelmingly, people are in favour of the strongest possible measures. And they are overwhelmingly in favour of really strong action being taken. So I think there is a very strong public will behind this that we need to grab hold of. So I'll stop there and I will just post I'll just fiddle around with this, and I'll post the website and the open letter into the chat. I'm happy to take any questions.
Fantastic. Thank you so much, Chloe. That was great. We're going to open this back up to questions again in a second. First thing I want to do, however, is just put this back up on the screen. If you were here at the very beginning, you'll have seen this already, but these are our links to our websites, some of our upcoming talks. One thing I actually haven't got on here, which I probably should have, is that our chair, Nikki Jones, is doing 2 talks about whether nuclear power is the answer to anything, really. It's a 2-part talk on the 22nd and 24th of February. Details of that are on the events page of either the Clifton Climate Action or BCR Energy Group website. She is chair of both groups. We've got all of our projects, all of our websites and things. Please do go and check that out. Please, if you've enjoyed tonight's talk and you can afford it, etc., please do consider supporting us through PayPal, or if you really don't like PayPal, you can email us. Our email address is cliftonclimateaction@hotmail.com or info.bcrenergy@gmail.com. You can find both of those on the websites. We'll send you our bank details if you prefer not to use PayPal, and you can make us a donation that way. Okay, I have to get that in now because sometimes people hear the speakers and then they leave. So we've got some interesting questions and some good little comments. One I wanted to just read out because I know Susan doesn't have access to the chat box once the meeting starts because of her tech setup. I know this is a particular bugbear of hers, but she basically she wanted me to say on her behalf, prior to COVID, the continual volume of density of traffic that poured in and out of Black Boy Hill, top of White Ladies Road from all directions was truly, truly alarming, and relentless might be another way of putting it. I am convinced breathing in the fumes, which is virtually unavoidable as a pedestrian, and shopping locally has affected my health. So, I mean, we've got the science to prove it. We've got the anecdotes that back it all up. Yeah, I thought that was worth including in the discussion. Right, so yes, so another comment that came in while Chloe was speaking, which I think is worth mentioning, is that between the speakers, I clarified that the UK had the girl Ella, I forget her surname, but Ella was officially the first person declared to have died because of air pollution. And what Pippa wanted me to make absolutely abundantly clear to everyone is that this was the first time that was officially stated by a coroner. There have been other people, inevitably, probably many thousands across the world, who have died directly or at least partially indirectly as a result of air pollution. This is not the first person to have died of that, but this is the first time that a coroner has officially, on a death certificate, stated that that was the cause of death. So just wanted to make sure everyone was on the same page about that one. Grant had an interesting point, which was that the deadline for public info, the public into Bristol Airport's appeal, Grant believes is the 22nd of February. If anyone else knows different, please let us know. But of course, we had Chloe. Is that a hand? Do you?
Yeah, I think that's the point at which the WECA need to make their position clear, and then I think the appeal itself is actually being heard in July.
Okay. because at the moment they've been told you can't expand. They're obviously appealing that decision, and fingers crossed they lose that appeal, if for no other reason, just for the air pollution. Because as Grant points out, expansion would make it much, much harder for us to achieve properly clean air. And then a proper question. Nicola wanted to ask, how does the WHO come up with what they consider to be a safe level of air pollution, essentially? How do they decide what is safe? Kat?
I don't know the answer to that. I don't know if you do, Kat.
Well, from what I've read, and I had a quick look actually when I saw that question come up, because from what I'd been reading, recent evidence is not showing any safe level, particularly of particulate matter and ozone exposure, that there is no level below which health effects do not occur.
Right.
And actually, in the most recent guidelines of the WHO guidelines at 2014, they did state that. They said emerging evidence is suggestive that there is no safe threshold. For nitrogen dioxide, what I imagine they do, and I'm not a statistician, but is that they'll be looking at effects. They'll be trying to quantify at what point they're seeing the effect in data and evidence, and that's often mortality. What we obviously know is there's a great deal of ill health before you get to mortality, and actually that's been recognised in the executive summary that they brought out in 2014. So I don't believe there is a safe threshold. I think they have to establish a target, and that's dependent apparently on on what different governments can achieve, and they're due to have updated guidelines. It looks like that was aiming for 2020, but I don't think they're published yet. So I think there is because of they recognizing the complexity in the effects that it has on our physiology and therefore the whole spectrum of disease. I'm sure it is very difficult to ascertain at what level things start occurring. But I think it's safe to say that is actually exactly as Chloe was mentioning, that what should we be aiming for? So the British Lung Foundation have asked that the threshold be lowered for levels of particulate matter and nitrogen dioxide to half of what WHO are asking for, and at the moment that isn't supported by WHO, but there is enough evidence to demand that.
Okay,
I hope that's helpful.
Yeah, I think it's a really interesting question of, who gets to set the lines, what are their objectives? And I mean, I do not envy anyone having to put a number on what this is, because you'll get people saying, well, that's too low, that's unachievable. You'll get people saying, no, any amount is dangerous, we should therefore be aiming much, much lower. So it's a nearly impossible job. I thought what Chloe was saying about is compliance enough is a really interesting point. It's a start, I suppose, but after that, if we don't see improvements in health, presumably the campaign will keep chugging along, and we will continue to push for better and better air quality, I would have thought. Is an interesting one. So we had talked, but both Clifton Climate Action and BCR have talked in the past about doing some sort of climate-themed hustings for the mayoral election. We've decided, ultimately, if anyone who's coming tonight is hearing this for the first time, we've decided against it only because we expect other groups with broader reaches and larger audiences to possibly put on the similar thing, and we don't really want to be holding hustings between representatives of all the different candidates. We would rather be able to go ahead with it where we can actually get the candidates in. So we're not doing it, but have XR, RRR City, anyone like that considered doing a air quality specific hustings for the mayoral candidates? Is that something that you might consider doing?
Yeah, we've talked about that a lot, and that will be a conversation we return to now that we've had confirmation that the elections are going ahead as planned. We know that because of COVID, the opportunities to hold hustings will probably be limited, although I think they could quite happily happen on Zoom, and we could probably do more of them. But they will be limited. So what our priority now really is to build partnerships so that we take the opportunities that are there to and make sure that these questions are represented. So that's something that I'm working on at the moment. Actually, I'm reaching out to the Bristol Green Capital Partnership to say, look, can we work alongside you in respect of the making sure that environmental concerns are represented as questions to the candidates?
Definitely, yeah, absolutely. Good luck. Another one from Julie. A group such as ours tries to encourage action on various eco fronts, but we often don't have the bandwidth to develop campaigns around specific issues. We need ideas handed to us on a platter. I'm reading that verbatim. Is OAOC likely to be handing out any such ideas of projects that sort of we can take the idea and run with our own version of it?
This is the best question ever. I'm delighted it's been asked, because the answer is yes.
How exciting.
We have got lots of action ideas, and so if you would like us to share those with you, absolutely thrilled.
Definitely.
So one of them is so obviously there is the letter that's there to be, the open letter that's there to be signed, but what we're also trying to do is have that letter recorded by lots of different people speaking in different places all the way across the city, for, from their doorsteps. So something we can record COVID safe, but make sure that we are showcasing people from across the city reading the words of the letter. So that's one thing. And then there is the opportunity to make a video of your own, in your own words, talking about why this is an important issue to you. But also there are loads of actions that are coming out of the planning at the moment that need engagement and people to jump on board with. So yes, let's talk.
Great. And if anyone is watching thinking they'd like to get involved with something like that, obviously you could go straight to the source and get involved with Our Air, Our City. But if you wanted to try and make Clifton Climate Action or the BCR Energy Group more air quality focused, join us and then come to our planning meetings. We do them at the start of each month. Yeah, try and strong arm us in that direction. We're always keen to get more people involved.
Well, that's where it'd be really great to have a conversation about whether both groups would like to be partners on the campaign, and then that gives us a platform to really share that the information and to have a deeper conversation about it.
Definitely. Yeah, I'll keep going. Is there any evidence for noise pollution being a factor in ill health? There is chronic noise pollution in parts of Bristol. We had a talk last year on light pollution, and particularly the effects that has on biodiversity and also people's mental health, because they don't get enough sleep because of all the light that they're being exposed to and all those kind of things. But we've never talked about noise pollution before. Do either of you have anything you want to say on that?
I mean, only to say that I'm sure that there is an impact on ill health and conditions, whether that's sleep related or mental health or things like headache and tinnitus. I couldn't tell you the evidence of that, and that's not something I've looked into particularly, but I think it certainly, and I think it makes us question like the environments we want to live in. And I think that people, particularly some of those people that we were discussing earlier, vulnerable people don't get a choice over some of these things. And I think what part of what I've realized is that within the limit, sometimes in the limitations of a GP consultation or as a health professional, is how you can empower people, communities to say what they're entitled to or what they feel isn't appropriate. And I guess I'd plonk noise pollution in there as well, and know who you could go to and how you get your voice heard. But it's not an area I'm particularly well versed in at the moment.
Yeah, I'm just now thinking what areas of the city would have the worst noise pollution. I guess somewhere near Avonmouth, where you've got the big factories and things whirring all the time. It's a topic for another time, perhaps, but it's an interesting thing to think about. Got someone here just saying, it probably hasn't helped my lack of motivation for going my lunch run. Yes, well, actually, that's an interesting question. If so, you showed that graph, Chloe, which showed that the levels of dirty air in the city are better now, thanks to lockdown, than they had been in the previous year. But do we think health outcomes are also being improved by people wearing masks more? Because I'm generally, if I'm going to the shops, I know I'm going to have to wear a mask once I get there, so I'm just wearing it down the street anyway. So presumably that is having positive effects on my lungs.
Yeah, and particularly with the spread of like our normal respiratory pathogens, we've seen, you know, reduced rates of them. People haven't had colds, flu, it's quite to the same extent. And we're not seeing children with bronchiolitis and croup in the same way. So there will be some benefit to that. It's difficult to know what's due to people not mixing as much, particularly children. But there will be some positive effects from noise, from mask wearing. Going back to the going for a run, I mean, this is suddenly something that started flaring up in me a bit, is that there is advice that on high pollution days people shouldn't be exercising outside. That's some advice given by respiratory, you know, teams and things, especially in London, and that to me just you know, incenses really, because it's, you know, it's something that is so vital. We tell people all the time that going outside is good for their mental well-being, good for you know, obviously exercise and combating things like obesity, and then in the next breath to say, but don't do it on these days because the air's dirty. It seems fairly.
It seems cruel, doesn't it? Like the one thing that is supposed to be objectively good for you somehow has become bad for you if you do it in the wrong way. Like, come on, just trying to be a healthier person.
Exactly.
No,
and in particular, I think when that impacts people unfairly, again, like just coming back to someone who has asthma but wouldn't want to go outside because they think that it would trigger their asthma. We want to educate patients that air pollution can trigger their asthma and how to manage that and how to use their treatment appropriately and recognize it as a trigger. But what I certainly don't want is for the first option to be that person having to take responsibility by staying indoors. I think is not what I want to see.
Absolutely. We clearly touched a bit of a nerve with the noise pollution thing, because we've got comments about how it's affecting people next door, talking about how it's affecting their sleep and their mental health. Caroline pointing out that it's obviously a big problem near the airport. Isabella talking about living near motorways and never hearing silence. Someone also commented above, I think, about Isabella again, how many people you heard last April, I guess, talking about how nice it was being able to hear birdsong again, which we hear so little of in our cities. I think that's a really interesting topic. Any more questions before we go? I would like to ask one. I think Chloe makes a really good, important point that air pollution is a huge problem and it's not fair to put it on individuals. We should be holding our council responsible and asking for them to implement solutions that we can all live with. But you made an interesting point about how part of the reason why it's unfair to put the onus onto individuals is that a lot of people don't have a choice. And it made me think about, you know, the coronavirus and things. A lot of people seem to be getting blamed for the fact that they have jobs that they have to go to and they have to use public transport to get to those jobs, and therefore they have no choice but to spread the virus. And people seem to want to blame them more than a government that didn't pay them to just stay home and not work, for instance. And so I think you're absolutely right on that point. It is important not to blame individuals when the council should be doing more. But at the same time, we represent Clifton, Bishopston, Cotham and Redland, which are, you know, you said it yourselves, privilege. It's an issue of privilege, and we represent some of the most privileged areas. I'll hold on my hands up right now. I am more privileged than probably 90%, maybe more, of the people in Bristol. And if you saw my flat, you probably wouldn't know it. But I can do more to reduce my air pollution contribution, and I'm sure many of the other people in this meeting can. And so I think it's important to remember the role that the council absolutely must play in solving this, but we shouldn't let people like me off the hook. And so I don't have a wood burner, for instance. I don't actually drive a car. I wondered, and obviously I know this isn't the focus of your campaign, but what other things can I do? And I'm someone who is saying I want to do more as an individual, as well as challenging my councillors. What can I do as an individual to improve the situation? Do you have any recommendations, any resources I should go and check out?
Well, I think there are personal choices that you can make, and we can only make those personal choices if we're really informed about what the choice is or what the impact is. So I live in a house. I moved here 18 months ago. It has a wood burner. Last winter, I was burning wood in it, not all the time, but occasionally I'd light a lovely fire, and that's really nice. It wasn't until earlier this year that I became aware of the appalling impacts on the air in my hyper local area of that wood smoke and of the particulates that are within it. So I choose not to now. But if I hadn't been party to that information, I would probably still be going, oh, it's a really chilly evening, I'll pop a lovely fire on, it will be really nice. And I think there is also an awful lot of deliberate misinformation out there. You know, there's a lot of talk about particular diesel engines, you know, Euro 6 diesel engines. Oh, they're fine, they're clean, they're all right, you're okay if you're driving a new diesel. Well, you're not. But you know, that information stream is being managed by this massive machine that is the car industry, which is being driven by, you know, which is intimately connected with our politics. So there is a, you know, and that's why one of XR's key demands is tell the truth. Let's strip all of the politics out of this. Let's just look at the truth. So you know, there are decisions that we can make if we've got the right information in front of us. But I think XR is very anxious and very not to tell people how to behave differently. That's a real policy of that as a movement. I see the council doing it, and I feel really uncomfortable about it because yeah, you can't expect people who haven't been properly informed to make the right decision. And sometimes people aren't going to make the right decision anyway, because it's really nice to have an open fire, and it's probably really nice to drive a big car. That I think those are things that we, as part of this campaign, can't engage with.
Fair enough. I'm not part of XR. I don't have a problem telling people stop driving that enormous car. It's disgusting and I hate it.
You go for it. I mean, personally, we can do anything we like as individuals, can't we? It's what you do under the banner of the campaign.
To be clear, that's not, you know, the official position of Clifton Climate Action or the BCR Energy or anything. It's just they gave me the microphone and I'm going to say it. I hate big cars. Right. We've got a couple more questions and I think we'll wrap this up, because this has been a really good evening and I don't want it to drag on too long and everyone to suddenly stop enjoying themselves. Catherine makes a point. There is definitely evidence of green walls being used tactically to protect residential areas from nearby roads or traffic, so improving the CO2 element of air pollution and the barrier to other forms. So I think you're talking about that as a positive.
Yeah, I was just trying to answer. There was a question just about the role.
Yeah, that was your comment.
Yeah, no. I just, from, again, not an expert in this in terms of like town and country planning and how these decisions are made, but you know, that being able to use trees, green space, or, you know, as a barrier, because, you know, we would love to strive for perfect. Yeah, you know, I would love to say that we all are going to, you know, clean air is no particulates and no gases. That isn't a reality. But what we can do in the meantime, I know that people, you know, and designers have managed to, you know, use green things as a barrier, and that has shown to be helpful, and is, you know, improving the way that things look and hopefully encouraging wildlife as well. But
yeah, to be clear to anyone who missed it, that was in response to Nicola's question about the effect of trees in cleaning the air. For more on that one, we had a talk in December about getting more trees for Bristol with somebody from the Bristol Tree Forum. I would go and look up Bristol Tree Forum or find the video of that talk on our YouTube channel for more on that. And Grant in with the perfect thing. If anyone wants to know more about the effect of wood burning, check out Residents Against Dirty Energy. They have a website, raidbristol.com. That's RADE, not RAID. And yeah, that's another good resource just for people like myself who want to find out ways to pollute less. But okay, I think and we've got a couple of people just coming in saying how much they've enjoyed the talk. Some of those green walls along the motorway for noise. Yep, another good point. Noise pollution. Maybe we need to do a proper talk on noise pollution. We'll add it to the list. But yeah, thank you everyone very much for coming. Huge thanks to both of our speakers, Kat and Chloe. Thank you so much for doing this. Really, really enjoyed both of your talks. Please check out everybody here, RARE, R City, XR if you like. Check out all of our links. They're on the screen in front of you. I should have said, any donations made to paypal.me/Clifton Climate Action within the next few days after this talk will be split evenly between the two groups, because we pay evenly to put the talks on. Oh yes, Libby wanted me to just quickly make a shout out, although I did say, Libby, I don't know if I have your email. Libby wanted people to drop off old mobile phones at smaller footprints. Let me see
if I could just,
if I
could just give a bit of information. So it's a project called Community Calling, and basically we're refurbing unused smartphones. They have to not have a cracked screen and be able to hold charge, but you could either drop them off at smaller footprints or look up Community Calling Hubbub and send off for a free post envelope. And basically those phones get refurbished and given out with a year's worth of data, texts and calls to digitally excluded people over the Bristol city area. And it's a really amazing project. We're working with refugee groups, domestic abuse victims groups, drug and alcohol rehab groups, homeless charities, and Age UK as well. So it's a really, really fantastic project, and we want to give out 1,000 phones across the Bristol area over the next year. So if anyone has a phone that's sitting around not being used, apparently for every smartphone there's 4 smartphones that are sitting in a cupboard not being used. And if you would like to give that a new lease of life, then yeah, then please do. Thank you.
Right. Yeah, no, yeah, sorry I didn't get your specific little press release thingy there, Libby. I don't know what happened to the email. But yeah, that's a little aside, cool thing. If you've got an old phone, do check that out. We will be back in 2 weeks' time, Thursday, 25th of February, talking about plastic pollution with City to Sea. 2 weeks after that, palm oil. 2 weeks after that, shipping. Possibly not a talk the second Thursday of April. We may take that one off just because it's right around Easter. And who knows, by then we might all be allowed out of our houses and we won't want to go anywhere near another bloody Zoom. But we will be back further down the year. Thank you everyone who's come. Thank you to both of our speakers again, and we will see you at the next talk. Thanks very much.